with one positive diagnosis. As of Thursday, its state lab has the capacity to test 85 additional people, and it is prioritizing testing for those who have come into contact with a person known to be infected. A spokesperson said the CDC is providing overflow testing if needed. In Texas, after initial issues with the CDC test, their spokesperson said that their state public health labs have the ability to test as of last week. A lab in Austin, for example, has run 2 tests and is capable of running 52 tests a day. Chris Van Duzen, a spokesperson for the Texas Department of State Health Services, says that if someone has COVID-19 symptoms and travels to an area where it is spreading or other possible exposures, they should see a doctor. And the doctor will consult with officials about whether a test is warranted. He says it's not always black and white, but with limited capacity, they need to prioritize testing for people who really need it, quote unquote. And that helps us learn more about the situation in Texas. In Utah, they have received 2 test kits from the CDC, most recently on February 29th, and initially had issues with the tests. Utah has also paid an undisclosed amount for a test from a commercial provider. Utah has tested at least 5 people as of Friday, and they are capable of running 60 tests a day. In Vermont, as of Wednesday, they have had enough supplies from the CDC to conduct a total of 250 tests. As of March 6, the state has tested 8 people, all negative. Ben Truman, a Vermont Department of Health spokesperson, said, "We can currently run 26 tests a day, but we have plans to ramp up to 52 and later 78 tests a day, if needed." In Virginia, they received 2 test kits from the CDC, February 10th and March 3rd, and they have requested a 3rd test kit. Due to extensive validation required for each test, the state estimates having the capacity to test only 50 to 60 people per kit in Virginia. They have tested at least 31 people, with 21 negative and 10 pending. Dina Potter, a Department of General Services spokesperson, said that although they have been able to meet the demand so far, they will need additional test kits from the CDC in order to be able to meet the increased demand for testing. In the state of Washington, the hardest hit state by the outbreak so far, the spokesperson said, "When testing first began, there was a problem with supplies we received. We've been running our tests in our lab since February 28th with corrected tests." In Washington, as of March 4th, 209 tests were run in the state, representing 91 people. A spokesperson said Washington's State Public Health Lab can run up to 200 tests, 100 people per day. The University of Washington Virology Lab, which came online this week, is expecting to run 1,500 tests, 750 people per day in Washington State. In West Virginia, testing is currently being done by the CDC and must be approved by the state's Division of Infectious Disease Epidemiology. West Virginia's Public Health Lab has received 1 test kit, which it said can run 400 to 500 patient specimens, and expects to receive another kit next week. Allison Adler, a West Virginian Department of Health and Human Resources spokesperson, said the State Public Health Lab is in the verification process and is expected to be able to run tests within the next few weeks. As of Friday, the state has tested 3 people, 1 negative, 2 pending. In Wisconsin, When asked how many the state had received from the CDC, Alan Bateman, Assistant Director for the Communicable Disease Division at the Wisconsin State Laboratory of Hygiene, said it is not easy to quantify, but the state can currently run about 100 tests a day, and it is capable of testing hundreds of patients. Its test is not like a pregnancy test where one stick is one result for one patient, the spokesperson said. Instead, it uses a lot of different parts or inputs that go into each test. At any given time, one particular input might be a limiting factor. Wisconsin received the first batch of test kits from the CDC on February 7, found that the tests were faulty, and has since received new kits that have passed Wisconsin's own verification testing. These tests are now working. As of Friday, the state has tested at least 44 people, with one positive case. In Wyoming, as of Friday, they had submitted one request for testing to the CDC. No specific numbers were given for testing capability, but a spokesperson said that based on the low demand they had seen so far, they feel confident they will be in good shape for some time. Keep in mind that the population of Wyoming is quite low as well, said the spokesperson. This is Coronavirus News Live. I am Bill Madon. Thank you for tuning in, and good luck.